Hi there.
Hi.
Jeff.
Allison.
Hi, Allison. Nice to meet you.
I'm Nancy.
Hi, Nancy. Nice to meet you. Welcome to SickKids. Well, thanks for taking the time to come today. It's really important that we connect with past patients and their families, hear their stories as we reimagine our campus. As you know, we're undertaking a significant redevelopment of our campus, and engaging the community is going to be so important as we undertake that very significant renovation. So we're standing in the atrium component of our campus. This is where the majority of the patient care takes place across our campus. This was actually designed in 1983, before the advent of even the internet, and didn't open until 1993. So a lot of people think that the atrium is the newer component of our campus, and indeed it is. But some pieces of our campus are over 70 years old. I think we're off now to meet some of our clinical providers on the floor and learn more about the challenges that they're facing in their respective clinical areas, so that we can all better understand what our clinicians face on a daily basis.
Well, welcome to the ICU. We'll start this first part that the parents actually come to interact with before going to the ICU, and to interact among other parents, is in this waiting area here. It's crowded. There's no privacy, but and we've encroached on that space a little bit over time to help create other space for other needs as well. So this is one of the areas that we really do need to address in the future. It's just not suitable for any sort of privacy, and to help with parents, particularly when their children are over here in the most critically ill state. So we admit about 2,200 patients a year into this space. There are 42 beds. We have about 14,000 patient days. What that hotel management means is rapid turnovers. We turn over about 30% of the beds every day, patients coming in and out. And that patient flow, that hotel management, is a really key part of how we can try and maintain and meet the demand for the volume of patients coming through. So the new SickKids will almost double the size of our critical care space in terms of the number of beds that we have and the footprint in which we can manage them. This corridor should be open and unobstructed. You can see how cluttered it is. That's become just a part of life here. It's the only way we can get the equipment and the resources in as necessary for the patients. It's not acceptable, but that's the reality, and we will. So in this room, you can see the 4 patients. So a lot of technology. We have monitoring devices all around him as well. So we're trying to monitor all the vital signs and make sense of that as well. And Sue over here is one of the most experienced ICU nurses there can be, and she's responsible for aggregating all of that. She has to do that within a space outlined by the red tape here. When Jack's parents come in, they can sit here, but if there's other work going on or other things being done to other patients in the room, they leave because of privacy concerns. But there are other things that are a problem here as well. These vents here, that's our HVAC, turns the air over at best 12 times an hour. What we have to do is turn it over 20 times an hour. Same with the windows. Windows, beautiful sunny day outside, windows are drawn. It's because these little ones here get overheated. We just have no temperature regulation. This building was opened before the internet, so we had to snake wires through. There are dead spots with the wireless, but we can't upgrade because the ceiling height's so limited.
So we're now heading to the neonatal intensive care unit. Where we came from was the pediatric intensive care unit. So where we're going now is for newborns that are critically ill and need the highly specialized skill and expertise of our staff here at SickKids. So as we go into the unit, Estelle, we were able to recruit you from the US. So
true.
Can you tell us a little bit about what made you come to SickKids?
Well, I was at Johns Hopkins, and I came to SickKids because it's a leading hospital here in pediatric care. In addition to that, it attracts trainees pretty much from all over the world.
Any big surprises when you arrived here, Estelle?
The volume of the complexity of the illness,
Right.
and the nursery. I mean, the neonatal intensive care unit it's totally out of date. And the reason why this is so important, it's not necessarily just because about space, about making people comfortable, but it has some impact. It has impact on infection control. And our babies are what we call immune compromised in the sense that they don't have all the immune system to fight off infection, and so it becomes a problem when in fact you're too close together. We know that from lots of data. And in fact, the standards actually say that even in a multi-bed room, that you in fact should have 8 feet between each baby. I'll show you here, we have about 4 inches. I don't mean to be trite, but in fact it is a small space. So as I mentioned a moment ago, that our neonatal intensive care unit has multiple rooms, and in those rooms it's multiple beds, sort of like a ward style that, as I mentioned, is not state of the art. And you see this red strip. This is this baby's space and that baby's space. Just imagine 2 parents and a nurse beside the bedside here. There's just no room.
So we're going to head in now to the bone marrow transplant unit. Again, this is another area of our campus which needs significant redevelopment.
So we are currently the unit that cares for children requiring a bone marrow transplant or cellular therapy across the province of Ontario. And we also treat children here coming from the Atlantic provinces. We do about 100 to 110 bone marrow transplants. About 2 decades ago, we moved into this new space. I happened to have been a nurse on the unit at the time, and I remember moving the patients over to the unit. And since that time, we really haven't done any physical upgrades because we really are landlocked. So just imagine for a moment being a teenage patient with their family, being cared for in this room for 22 days. You're at very high risk for infection, so you're not allowed to leave the room because we don't have positive pressure HEPA filtered hallways. We have pressurized HEPA filtered air in the actual patient space, but because we don't have it in the hallway, patients can't walk around and get exercise. Mom or dad would be staying beside them in the chair right behind you. It does pull out, but you can see it's really limited space. Part of being in this room when you're a teenager is not having a washroom. So we actually pull in commode chairs, and that's what we use for washrooms. So when I used to care for teenagers in this space, what they want more than anything is a shower and their own private toilet.
What really stands out for me is that the level of empathy and caring of the staff is really outstanding. That was my experience here more than 15 years ago, and that seems to really be the biggest takeaway from today. And I can only imagine how the experience will be exponentially improved by new facilities.
You know, when I think about SickKids, I think about the care that the kids get, what my daughter got. You don't really think about the physical environment. So seeing the spaces that the staff has to work in and that the families have to be with, it's too small. It's too small for such an iconic hospital. I think the patients would say, you know, keep the staff. Staff is good, staff is great, but a little more space, a little more up-to-date, state-of-the-art. I've been in other hospitals, older ones, and then the brand new ones that have been built in the last few years. And it's just such a difference that it makes to not only how the staff is able to do their jobs, but for how the patients and the families can deal with what they're dealing with.